The coronavirus has exposed the loopholes in our public health systems. Countries across the world have run out of vital supplies and protective gear, so much so that frontline health workers are being forced to wear garbage bags. In some countries, they are protecting themselves with raincoats. Here's a report.
In 1916, the United States sent its soldiers to war without necessary gear. Lucky for them, the war turned in favor of the Allies. Over 100 years have passed since the First World War. Today, the United States is fighting another battle. It's been called World War III. The Wuhan virus is the enemy. Hospitals have turned into war zones. But this time too, the men and women at the front line are ill-equipped. Washington does not have enough personal protective equipment for its medical workers. What are PPEs? These are protective gears worn to minimize health or safety hazards at work. In their absence, nurses are being forced to wear trash bags. Many nurses from New York have posted pictures on social media with the hashtag risking our lives to save yours. Who is to be blamed for this? The US federal agencies for their utter lack of preparedness, the state governments, or the hospitals?
Because if we get sick, then who's going to take care of them?
Nurses say the situation is criminal. Guess who is Washington's partner in crime? War ally, the United Kingdom. London too is sending healthcare workers to war without armour. 3 nurses have already tested positive. All of them were forced to wear trash bags. In one London hospital, 50% of the staff at a particular ward have tested positive. Reports also claim that doctors are being bullied into treating coronavirus patients. With no PPE, doctors are being told to hold their breath. If you ask the British government, they would blame it on the hospitals. The United Kingdom has already lost 17 frontline medics to the coronavirus. Shortage of protective gear is a reality in India too. Doctors are using raincoats and sunglasses to fight the virus.
In place of PPE, there was a raincoat. Okay, raincoat, and with that the scientific goggles, no scientific goggles, they provided a sunglass, black colored sunglass. You know, a physician needs to see the color of the patient.
China too was scrambling for protective gear during the outbreak. Beijing bought surgical garments worth $12.6 million from the US alone. This is the state of some of the world's richest countries. There's shortage, there's confusion. The Wuhan virus has caught everyone off guard. The contagion has also exposed the loopholes in public health systems. The need of the hour is to develop and procure vital equipment. Health workers cannot and should not be pushed to risk their lives without basic protection. Bureau Report, WION, World is One.